In the field of emergency medicine, effective spinal immobilization is vital when patient assessments indicate the potential for spinal injuries. Whether it is a motor vehicle accident, sporting accident, or other incident requiring spinal immobilization, quick, efficient spinal motion restriction using a rigid, reliable stabilization system is an essential part of providing patients with the highest possible quality of care. The Tomcat ICID, or Integral Cervical Immobilization Device, offers unparalleled excellence in emergency spinal immobilization. The Tomcat's unique design focuses on spinal motion restriction, rapid deployment, patient comfort, and in-vehicle storage. At the 2006 EMS Expo, the editors of EMS magazine identified 20 new products showing significant innovation. The numerous Tomcat features earned Tomcat ICID a place on this list. The Tomcat ICID's system consists of a rigid backboard, 2 plastic paddles with rubber boots and locking pins, and a disposable CID kit. Assembly is fast and easy. Install 1 paddle at a time. The paddle legs slide easily through parallel slots on the front surface of the backboard. Once the paddle legs have passed through the slots, the long red pin slides easily through the bottom opening on each paddle leg until the pin locks into place. The same procedure is repeated for the second paddle. Next, fold down both paddles flush with the front surface of the backboard. You will feel them snap into place. The disposable CID kit contains 2 disposable yellow straps and 3 pre-cut pieces of adhesive-backed disposable foam, 1 for the elevated area on the backboard and 2 for the paddles. The yellow disposable straps attach to the paddles. Insert the strap under the strap storage clip formed in the paddle. Make sure the yellow side of the strap will be facing out toward the healthcare provider. Align the pre-cut holes in the strap with the attachment posts on the paddle. To accommodate the vast majority of patients, we recommend using the first 2 holes in the strap, though this can be quickly adjusted in the field for those exceptions such as children. The first 2 holes are spaced to accommodate larger patients, and the 3rd and 4th holes are spaced for your pediatric population. It is important that you do not load the strap with the white side facing out towards the healthcare provider. This will compromise the Tomcat's effectiveness immobilizing a patient. The CID kit includes disposable soft foam with an adhesive liner that easily peels away. The liner backing is designed to overhang the foam surface, making it easier to grasp with a gloved hand or when facing difficult field conditions. The adhesive-backed foam is then placed onto a clean and dry surface on the backboard and paddles. By the nature of the design, a gap will be present under the strap slot of the paddle. This gap is necessary when deploying the strap and securing the paddles together during immobilization. These disposable components are intended for single patient use in order to reduce the potential transmission of blood-borne pathogens. Tomcat ICID's patented design allows the paddles to fold down flat and snap down against the front surface of the backboard. This provides for easy storage in most standard backboard storage compartments. The contoured design provides additional patient comfort and security. In order to maintain neutral spinal alignment in adults, the Tomcat is designed with the board surface elevated in the area where a patient's head would rest. To help prevent flexion in children, the healthcare provider may need to generously pad the child's upper torso to better maintain neutral spinal alignment. Pupil gauges are strategically placed on the upper edge of the paddles to assist the healthcare provider in completing a rapid pupil assessment. A Glasgow Coma Scale and Rule of Nines scale are also provided on the front surface of the backboard to offer the healthcare provider a quick reference guide to reinforce accurate patient assessments. The integrated O2 clip is also conveniently located for easy attachment of a nasal cannula or an O2 mask. This avoids the need to use adhesive tape to secure either of these devices. The paddle's ergonomic design is less intrusive and more comfortable. The large ear holes in the paddles allow quick and easy assessment of the ears and also decrease potential miscommunication between the patient and the healthcare provider. The large raised hand holes make it fast and easy to grab and lift even with a gloved hand. The backboard is X-ray translucent for clear views of the spine and is MRI and CAT scan compatible. The Tomcat ICID is exceptionally strong and rigid, able to withstand excessive weights with minimal flexion. By properly loading the Tomcat ICID, the time spent searching for multiple pieces of equipment in different compartments is eliminated. When immobilizing patients, remember to follow all local EMS protocols for spinal immobilization. As with all cervical immobilization devices, proper patient placement is essential to maximize the Tomcat's immobilization ability. Center the patient on the backboard so their ears line up with the ear holes on the paddles. Maintain manual C-spine control. Have another healthcare provider slide the paddles out and rotate upward to the desired lateral position. Readjust the paddles by applying lateral pressure on the lower half of the paddles so that the paddles are in moderately firm contact with the lateral side of the patient's head and C-collar. Once you are satisfied with the lateral position of the paddles, you are then ready to deploy the yellow straps. Pull the strap from the convenient strap storage compartment on the paddle. Place the strap across the patient's forehead and insert the end of the Velcro strap through the gap in the opposite paddle slot. Rotate the strap over the paddle and secure the strap onto the backside of itself. Repeat the procedure for the other strap. Readjust by pulling the straps tighter. To ensure a rigid system, it is critical that you snug the straps tightly against the patient's head. The paddles are designed to flex around the patient's head as the straps are tightened firmly into place. The Tomcat ICID system provides efficient spinal motion restriction without the extra steps and personnel needed to lift up the backboard while applying an immobilization device. For patients with helmets, you must use 2-inch adhesive tape to get the best results. Remove the rectangular pad on the backboard and keep the paddles flat. This creates a recessed area with the boots of the paddles supporting the sides of the helmet. With 2-inch adhesive tape, secure the helmet to the backboard by placing the tape over the helmet around the edges of the backside of the backboard. With today's medical technology continuously evolving, the Tomcat ICID is leading the charge to provide rapid, efficient, reliable spinal motion restriction and continues to prepare for tomorrow's challenges.